One of the major topics you may encounter in the clinics is hypertension, which accounts for 12.8% of the deaths worldwide. This disease refers to high blood pressure, which is when the blood within the arteries exerts a larger than normal force on the arterial walls. This pressure is caused by the heart pumping with more force than normal to adequately distribute blood throughout the body.
For hypertension, the biggest issues in the developing world compared to developed have to do with issues around awareness and treatment. So the rates of hypertension in many developing countries are pretty high. What's pretty low are the rates of people being detected if they have the disease, and then people being on adequate treatment.
Factors that increase the risk of hypertension include unhealthy eating, lack of exercise, and smoking tobacco. A heavy salt diet can also increase blood pressure. There are also genetic risk factors.
Bueno, dentro de los factores que pueden considerarse de alto riesgo para una presión alta, muchas veces puede ser hereditario. Si dentro de la familia se ha tenido esto, ¿verdad?, de la presión alta, muchas veces también influye un poquito lo que son los factores alimenticios, ¿verdad? Una mala dieta puede influir a veces en lo que es una presión alta, ¿verdad?
Like eating fatty foods, lot of salt intake, that's what causes us to be hypertensive.
Muchas veces también se puede tomar en cuenta lo que es relacionado a la situación actual en que vivimos, en una sociedad de violencia, en todas las presiones propias de familia, en las presiones a veces con los hijos, con el esposo, y todo eso puede influir dentro de la salud de la persona.
Because the heart is working harder than normal to perfuse the blood, it may begin to wear out, which can result in heart failure. The increased pressure on the arteries can damage the inner lining. This leads to plaque buildup in the arteries, which causes them to harden and inhibit blood flow. This is called atherosclerosis. The problem intensifies because as the plaque builds up, the heart has to work even harder to adequately perfuse blood to the body. This causes higher blood pressure, which then leads to more plaque buildup. The plaque can accumulate and form clots, which may completely block the artery.
This can result in heart attacks, kidney failure, strokes, eye damage, and aneurysms. High blood pressure can also damage and weaken the brain's blood vessels, causing them to narrow, rupture, or leak, which may result in a stroke.
You will likely be measuring blood pressure to determine if a patient is hypertensive. Blood pressure is determined by the amount of blood pumped by the heart and the resistance to blood flow in the arteries. More blood and more resistance causes higher pressure. When you measure the blood pressure, you will receive two numbers. The first, larger number, is systolic pressure, the pressure in the arteries when the heart contracts to pump blood to the body. The second, smaller number, is the diastolic pressure, the pressure in the arteries when the heart relaxes and fills with blood. The ideal systolic and diastolic pressures are 120 millimeters of mercury and 80 millimeters of mercury, respectively. A patient is deemed hypertensive when their blood pressure exceeds 140 systolic and 90 diastolic.
Unfortunately, it's usually at the very later stages. So when patients actually present with complications related to hypertension, whether it be a stroke or heart failure or kidney disease or problems with vision, etc., usually that's when people get diagnosed with having hypertension. Doesn't have to be that way. Screening can easily identify many of these people, but that's often how people will present.
Cuando vienen por otro problema acá, ¿verdad? Por ejemplo, vienen por tos o por dolor de cabeza, supuestamente ellos, ¿verdad? O que en la casa se han sentido mareados, o que ya se sofocan mucho al caminar, ¿verdad? O que ya no aguantan a trabajar, y entonces aquí se les toma una primera vez la presión, ¿verdad? Y se nota que hay problemas.
A patient can reduce his or her blood pressure by having a balanced diet, exercising more, and abstaining from tobacco use. Patients can also take specialized medication to minimize plaque buildup in arteries and reduce blood pressure.
Pues en la ciudad se cuenta con medicamentos, ¿verdad? Y les dan recetas, mas sin embargo nosotros para la presión alta, dependiendo, ¿verdad? Bueno, podemos empezar con lo que es la dieta, va a mejorar la dieta, el plan educacional que se le da al paciente. Y en segundo lugar ya serían los medicamentos.
Financial, to assist the medication, because now when it comes to medication for hypertension, it's more expensive.
There is definitely issues with lack of access to therapy equipment because of cost and the issue of getting the equipment to many developing countries. But what's probably the bigger issue has to do with repairing and maintaining medical equipment because the expertise often locally just isn't available.